part of my role includes providing advice to the government, to other police service areas involving drug abuse, trends. As you've seen lately, we've seen the fentanyl issue, so that sort of thing, and including the recreational cannabis area. So that started up, and we've been providing advice for quite some time. I didn't envision speaking in my lifetime about legalization, but here we are today, and in a little over a year, we're going to see recreational marijuana as a legalized product, so it should be very, very interesting. Just want to remind everybody, cannabis is still illegal, and it will be until it is legalized, and we anticipate that will be in July. I also remind everybody that dispensaries are still illegal, and as well, the only way to get if you're a medical marijuana user is through dispensaries, through the licensed producers, and it's by mail only. So that will change, but that's coming up very, very shortly. You're going to see as well, the focus of my presentation is going to have some social issues and the challenges we have from a policing perspective. You see a key theme is education. I think it's very important that we take the time now to educate. We're running out of time. It's important that we understand what we're getting into, and from a policing perspective, you can see some of the challenges we're going to see. You're going to see funding is going to be a strong issue for us, as it's going to be a cost from a law enforcement perspective, as we move from a regulatory body to a recreational system. And you're also going to see that training is a key theme, and as well, there's going to be a great responsibility for us as Canadians to make sure that we do this right and we do it appropriately. So a little piece about what the CACP does. So we've been established since 1905, and it's approximately 1,000 police officers, police services, police leaders from across Canada. The association is dedicated to support and promote the effective law enforcement and the protection of the security of people here in Canada. Through its members, police chiefs, and senior police executives, we provide insight and represent an excess of 90% of the policing community here in Canada. That includes First Nations, provincial, regional, municipal, transportation, and military police. The Drug Advisory Committee and the Traffic Committee have provided insight to the issues related to legalization, impaired driving, and the related issues that surround public safety. So that's a little bit about what we do. We meet from the Drug Advisory Committee, we meet quarterly, and we also have representatives from across Canada, from Newfoundland right through to Vancouver. So how do we get here? The government of Canada introduced legislation to legalize, restrict, regulate, and the access to cannabis here in Canada. Leading up to this introduction, the government held a series of consultations and mandated the federal task force to provide a report helping to shape this legalization, and the CACP participated in this process. Our role from the beginning has been to share our expertise from a national perspective with the government to help mitigate the impact of such legislation and the focus on public safety. Extensive discussions within the CACP membership and various committees form the basis of our advice. Included, a lot of this advice came, and we provided the marijuana task force. That was a task force that was made up of members from every part of the community, including former law enforcement, current law enforcement members, which provided 86 recommendations. And we've provided our input on those recommendations and what we feel is appropriate, what we feel is going to be mitigating factors, and as well some of the challenges that we're going to face. So I'm going to give you a bit of a picture today of what we're facing from a law enforcement perspective, some of the challenges we're going to see, and some of the things that are going to help us from an impaired driving perspective, some of the challenges there. Personal cultivation is going to be an issue, social caring issue, and the workload that's going to be behind how the distribution system is going to be in place, and what will happen, where law enforcement will be placed in regards to that, and what our role will be. So one of the big things that we've been facing, and the big questions that we're looking at, is impaired by drugs. As we know, alcohol and cannabis are two different products, and it's taken in upwards of 40 years for us to have an understanding and appreciation of what alcohol and impaired driving does. And now we're introducing recreational marijuana, cannabis, so there's going to be a big, big piece of education and understanding, and we're going to need the tools to do that properly. Our primary concern in Canada is going to be regarding the strong legislation and the focus on impairment by drugs. As you can see in Bill C-45 and Bill C-46, some big changes going on, and it'll also help with related to alcohol impairment. We've been told in place now, we have current systems in place that will work and are working right now that address impaired drugs. So if there's a perception that we haven't got the tools in place, we do have the tools in place now, but with the enhancement of Bill C-46 and Bill C-45, we're anticipating that we're going to have some better opportunities to address the public safety issues. So what do we have in place right now? We have standardized field sobriety tests. So what is that? So a traffic officer does a traffic stop, and he sees a driver that he feels is impaired by a substance. It could be alcohol, it could be drugs. A series of questions take place, but they have now been trained, not in particular, all our frontline officers are now trained with the standardized field sobriety test. And what that is a battery of 3 tests that are performed during a traffic stop to determine if the driver is impaired. Those include horizontal gaze, we're looking at how their eyes are moving, walk and turn, and one-legged stance. So it's basically about physical movements. And our officers are trained on how to make that assessment on the scene and address it, so it's from a drug perspective. So those tools are in place right now. But the biggest tool we have is the drug recognition experts. Our drug recognition expert program has actually been in place for quite some time and started in October of 1995, with the first national course being delivered in January 2003. The program received legislative support in July 2008, and we continue to train our officers on a regular basis so that they can provide expert evidence and make a determination on what if this person is impaired by drugs. So it's quite complex. It's a very extensive course. They're looking at all the different, they take your blood pressure, they take all these different signs, and they can actually make an established, informed decision as to what type of drug you're on and whether or not that person is impaired or not. So those tools are in place right now. And currently in Canada, we have actually 600 drug recognition experts in place. But as you can see, with the advent of legalization, looking at other places, we've gone to Washington State, I've been in Colorado, and they saw an extremely big leap in the use of cannabis and driving. So they saw a 32% increase. So that's going to be one of the things that we're going to be facing here. From a law enforcement perspective, that's one of our key issues. Public safety is number one with us. Steps are being introduced, as you can see in the new legislation, to address impaired driving, and the scheme to make sure that it gives us more opportunities for tools and more opportunities for us to detect and keep our roads safe. It's taken us decades, as you've heard, for us to address and teach our folks about the effects of impairment with alcohol. And if you look at our young now, the way we've done our graduated licensing now, you can't drive, you have to have zero alcohol presence in your system with graduated licenses. And we're seeing now that our young understand that, and they have designated drivers. This is the type of thing that we need to do and need to help understand, so when it comes to cannabis, we understand that driving and consumption of cannabis is something that can't mix at all. We've seen, if you go out, everybody knows if you go have a couple of beers, you know to some extent what your impairment is. You know you can have 1 beer or 2. In fact, you shouldn't have any, but people understand that. I don't think there's the understanding or the appreciation of what the consumption of cannabis can do on a person's ability to drive. And there's actually some myths out there that you can actually drive safely with the consumption of cannabis and driving. They've done tests in Colorado, and a lot of people thought, people are driving slower, they're they're approaching things safer, they're focused. Their review found the opposite, actually. It was all sorts of traffic violations that provided the officer got the attention of the drivers. The myth is that it makes you a better driver is false, and it is going to be a problem. So we've got oral fluid testing coming our way, and that's one of the legislation that's being introduced. We hope that goes through, and that will provide us those changes. As you know, we need to have more tools that protect you, protect myself, protect our kids. So we welcome and look forward to the introduction of approved roadside devices that detect the presence and level of alcohol and oral fluids testing. Currently, field testing units across Canada is taking place, and they've been taking place in all different conditions. As you know, Canada has extremes, so we're testing this device in extreme weather. It's being tested here in Gatineau, it's being tested up north, it's being tested out west. It's being manhandled, as our officers know. If you know their officers, they grab our equipment, they throw it in the car, and they run out and they take their equipment and do their work. So this stuff's been tested to make sure it's rugged, to make sure it works, but also that it provides us the appropriate results. So there's two systems that are in place right now that are being tested, and we hope with the legislation that we can see that device is approved. Will adequate and ongoing funding be provided? Nothing's free. Our folks with the approved roadside devices are going to be expensive, and if anybody's seen the roadside device for alcohol, it's a small device. It provides a level of alcohol in your blood, and there's a device that's used to transfer that information through your breath. Those devices cost 10 cents. So the cost for the devices are extremely more expensive to do a test. As you can see here, that's one device that's actually being tested, and that is not 10 cents. It's a little bit more expensive. We won't get into the price, but it's quite expensive. But it's going to be required, and it'll provide us the tools that we need to address that. From a social perspective, we're hoping that, so the people in this room are here for one reason, because they understand the responsibility behind cannabis, and they're looking at opportunities. It's the folks that aren't in this room that we're trying to get the attention for, and to make them understand that when the government of Canada made this decision and it was accepted, they were elected, now we have a responsibility, not only from a law enforcement perspective, but everybody here in the room, everybody out there, that we do this right, and we respect some of the conditions and the issues that come around it. So on July 1st, 2018 is the date that they say will be in place. From a CACP perspective, we certainly hopefully it's not going to be linked to the national holiday. As you've heard, that's probably not going to be the case. It's going to be beforehand, but we have a lot of work to do from our perspective. We need to train our officers to ensure that we have the drug recognition experts in place so that we can provide a safe environment for you to drive every day in your conveyances. So the purchase and maintaining of oral fluid devices will increase forensic ability for us to provide evidence and keep our roads safe. There's some other issues that will come with that. So laboratory testing will be a big thing, so we'll have to get some more laboratory testing. One of the questions we have, and in this room here, there's a lot of questions about what law enforcement is going to be doing. We have as many questions as we have answers. We're waiting for the results, so we know that what the federal government's going to be doing. We've had a good look at Bill C-45. We've seen Bill C-46, but there's still a lot of questions, particularly the fact that it's going to be downloaded. A lot of it's being downloaded to the provinces, and you're going to see as well that there's a lot of downloading to our municipalities as well. So here's some of the issues and impacts that, from a law enforcement perspective, that we're going to see. You shouldn't be surprised at any of them, but so these are some of the ones that we're looking at that there's going to be a problem. And some of them may not be excited about what we're going to say, but it is a concern that we have. Personal cultivation. That's an area that we actually did not agree with. And it's not because we don't agree that people should be allowed to grow their own cannabis in their residences. And the legislation is now recommending that it's 4 plants per household. So in Colorado, they allow 6 plants per person. over the age of 21. So we're happy that it's per household, and we're happy that they've restricted the size. Because if you've done any research on marijuana, you can see they've grown monster plants, and they can manipulate it from that regard. But we weren't big on that, and I'll tell you why. It's about who's going to enforce this. And we have a lot of responsible people, but from a policing perspective, from law enforcement, we don't focus on the good people, we focus on the people that abuse. And from a personal cultivation perspective, that's problematic. One issue that we may face is the fact that everybody can now grow, that will be permitted to grow 4 plants is tenants in apartments. Well, landlords now permit people to grow in their apartments. That could be a challenge. And who is going to be responsible for addressing that? And our concern is law enforcement is going to be looked at. So there needs to be a lot of regulatory bodies in place to address that. But just looking at the challenges behind that, and I'm sure you've heard some of the licensed producers describe the work involved in providing a good product. And if anybody's done it, I've done it. I've made my own wine. I thought it was delicious and I thought it was good. And then I realized I had a real bottle of wine. And I go, yeah, I'm no good at this. So that's one of the things you're going to realize with personal cultivation. It is an expertise, and it could cause problems. We've seen our grow ops and the real estate products. The real estate companies are now having to post if there's been a grow op in a dwelling house. And what's our authority going to be to enter a dwelling house? So these are the challenges, and this is one of the reasons why we weren't supporting. We get it. We understand that if anybody doesn't know, you can actually grow your own tobacco. But does anybody do it? No, because they don't make a good product. You can grow. You can make your own beer. You can make your own wine. Some are good at it. Some aren't. So we get the fact that personal cultivation is something, and we understand the rationale behind it. Social sharing. That's going to be a big issue for us as well. So from a trafficking perspective, where are we going to be? So is it social sharing? Is it from the personal cultivation? How is it getting out? So these are some of the challenges that we're going to be facing down the road. So the recommendations from other states and other locations and jurisdictions is that start restrictive and work your way out. So that has been the CDCP's recommendation. Start slow, very restrictive, and as people understand and appreciate what cannabis is, then we can loosen things up. So that was our position, and from a personal cultivation perspective, that was our plan. Start slow, start restrictive, and as people understand and appreciate the issues that we're facing, then we can start looking at opening things up and more appreciative and loosening our laws. So our recommendation was actually to keep it very, very restrictive and keep it to the commercial, keep it commercial, keep it restrictive, regulate how it's distributed, and do it properly. CDCP continues to recommend a merger of medical marijuana regime and the legalized regime. The reason we wanted that is, and you've heard about the different regulations. It started with the MMAR, then went up to the MMPR, and now it's the Access to Cannabis for Medical Purposes Regulation, which started in August of 2016. So we've seen the big changes. So you can see some of the challenges we're facing. One of them is designates. So from medical marijuana, we can actually designate the grower for you, up to 2 people. So you merge that with our new Bill C-45, and you speak to social sharing, you have a designate, people are driving, so it's going to be difficult from a law enforcement perspective, but we'll figure it out how to address the illicit from the legal product that's out there today. So it's going to take a lot of training, and it's going to take a lot of products. So we actually made a suggestion that the medical regime and the new Cannabis Act be merged so that our officers can have a better appreciation and understanding and merging of the 2 laws so that we can apply it appropriately, responsibly, and effectively. We see challenges, and a limit should be placed on personal possession from a private dwelling. That's another area that we see a concern. So you see the legislation, it's 30 grams in a public area, that's an ounce, but they haven't really defined what the personal possession limits are inside in a resident. That's a problem, and we're concerned about that. The issues are obvious. From a black market and illicit market, there's opportunities. We'll find a solution, but these are some of the challenges that we're going to be facing. So public education, I said that earlier, education is one of the key themes that we're going to have to look at. From a social perspective, there needs to be a comprehensive public education strategy that cannot be overstated, especially one focused towards youth, parents, vulnerable populations, and the need to begin immediately. We've been talking about regulations and the onset of recreational cannabis for quite some time. So on April 13th, it's been introduced in legislation, and we're probably 13, 14 months away. And I think it's very, very important that education, you're seeing education here from the licensed producers and the education here, but it needs to go out. Our youth needs to understand the ramifications. And I won't speak too much about the health issue, because that's not our expertise, it's about public safety. But they need to understand the ramifications around cannabis and the effect on the youth and the human brain. They're using the internet right now, they're Googling the Google machine, and they're getting their facts from there. We need to provide those facts from properly accredited folks, and it needs to be understood so they can make informed decisions. We also understand the rationale behind the age that's been put out. Do we agree with it? Not necessarily, but we do understand that you're an adult, the age of 18. It is linked to our alcohol consumption, and it's up to the provinces to decide. We get that. But we just need to make sure that education is a key component to, as we move forward. We have an opportunity now, and we need to spread the word about the issues surrounding cannabis, its use, and particularly with youth. Does the public have any sense to what the level of consumption of cannabis or other drugs would be being categorized and limits about this legislation? So one of the things that we've learned from the other states and countries is we need to set up our baseline data. So if this turns out to be a great success and it worked out well, we need to know where we came from. We need to know where our baseline data is. We need to know what our conditions are for conveyances, driving. We need to know our youth. We need to know how much consumption is in our schools, what ages. We need to know how the medical field, what issues are going to be faced in the medical field with regards to cannabis use. And we need to know what the medical regime is going to be about as well. So baseline data is a key issue. And again, we're suggesting it starts immediately. And so we understand the changes, and this is going to go very quickly. I could be standing up. Next time we speak, we could be talking about how it's now legal and creating the proper regime and the proper process for it to obtain and responsibly use cannabis in a public place, whether it'll even be allowed, and how to secure it, your resident, how to cultivate it appropriately, how to secure that. So public education is going to be one of the key areas we need to focus on, and it has to be set up and geared in a way so it's not about reading it in the newspaper, it's not about going and watching it at the 6 o'clock news, it's finding the medium that works for the audience. And with the public, it could be the community newspapers. From a policing perspective, that's when we want to get a message delivered to a particular community. It's not putting it in the mainstream news, it's putting it in the community papers. And for youth, it's using the apps and the information that they'll be accessing. So public education is something that from a social responsibility we need to start now, and we need to help the folks understand so they can make an informed decision once things get started. I spoke about training. Training is big for us. We've got to learn Bill C-46 and what it's going to look like. So we don't know what it's going to look like. We know what they're suggesting. We know what is being proposed, but we don't know what it looks like right now. Bill C-46, we know what they're asking for. We know what we need, but we don't know what it's going to look like. We have the medical marijuana regulations. We have the personal cultivation. What are the rules? How do we intertwine all of those? So that's going to be a requirement from a law enforcement perspective. In Colorado, they actually had set up a Cannabis 101 course for all officers so they understand. You know, it could be as simple as officers understanding what 30 grams looks like, understanding what social sharing is. We could be seizing from a location. Are we going to have to return it? If we made our mistakes? Is there going to be civil liability surrounding that? So these are all areas that we're going to have to focus on. Reforms for impaired driving laws are significant. General awareness needs to be prepared. Our officers need to understand if we do move forward and get an approved roadside device, they're going to have to understand its use and the proper way to handle and manage. How do you make proper testing? What are the rules? So if anybody's read Bill C-46, it is very, very positive from the perspective of eliminating impaired driving, but our officers are going to have to understand that. So if you go into the criminal code, you're going to see some of the most case laws from impaired driving. So we want to make sure that we get it right, and that we understand that when we go with impaired by drugs, which we are doing right now, and we're getting successful convictions, but with the advent of roadside screening devices and the new rules with regards to the amount of cannabis in your system, with as low as 2 nanograms and 5 nanograms, officers are going to need to understand that. So training is a big thing. We're going to need to start on that training very, very quickly, and that takes time. And we don't have the resources to take everybody off the road, train them in front and back, so this needs to be done very, very quickly. The government needs to address and federally fund a national training initiative to ensure that national training standards are in place and they're consistent across the board, across the nation. Resourcing, police resourcing. Another big issue we're going to be facing. It remains to be determined. I said before, we have as many questions as you. What is the impact of legalization going to be, with particularly dealing with distribution? Who's going to be enforcing that, making sure those regulations are in place? Licensed producers here understand they have inspections on a regular basis. It's not done by law enforcement. It's done by specialists that understand that industry very, very well. So we don't know who that's going to fall on right now. Whether it's going to fall on law enforcement, or they're going to set up a regime that's going to be similar to alcohol. So in Ontario, we have the Alcohol Gaming Commission of Ontario. They regulate our bars, all aspects of alcohol, and we actually do it as well. But that's one of the areas that we're going to have to focus on. How will Frontline deal with these challenges? Distinguish the difference of illicit and appropriate cannabis, particularly with personal cultivation. With personal limits not defined, when an officer deals with an issue, it goes into a residence. What information are they going to have to deal with when they see cannabis, whether it's appropriate, is it a personal possession, or is it a trafficker? These are some of the challenges that we're going to face. Canada does have the capacity to do forensic tests, but we need to also invest in forensic labs to ensure that we have the required and the labs in place to effectively and efficiently provide the prosecutions as we do it. As you know, that a new decision came out in the Supreme Court, R versus Jordan, now provides us restrictions on how long it takes to get to court. So we need to have the processes in place. So if we are doing fluid testing, whether it's urine or blood sampling, we're going to need to have those systems in place so that we can provide that evidence in a timely manner, so we don't deal with losing this in court because of the Jordan decision. So these are some of the faces and issues that we're going to face. And more importantly, policing and educating our youth. We've said it before, youth is our future, and the dangers of consumption at an early age and effects are important. So our school resources, right now, a lot of our schools have officers that come by and do presentations. I don't know if you remember when you were a kid, the officer came by and he opened the little box and he had all the different drugs showing. Well, that's gone. Now it's a lot more efficient, more effective, and it speaks to the true dangers with youth. So we've improved in that aspect. So is it going to be law enforcement that goes and forwards this information? We need to educate our schools, we need to educate our youth, and we need to educate them in the forum and the effective means that they can understand and make informed decisions. Who will subsidize that? Where's the funding for that? And to what degree will that will tax our resources from a policing perspective is going to be huge. And of course, we want to make sure from a perspective, you've heard already, organized crime has already infiltrated the medical marijuana regime, MMARs. We need to ensure that there's appropriate screening so that that's eliminated. So one of the goals of legalization is to eliminate the black market. There are means of doing it, but it needs to be done appropriately, and it needs to be given the funding, the resources required, because it's not going to be immediate. It's not going to be very quick, but we're going to have to focus on that once the Cannabis Act goes into law, and the recreational rules are now loosened up. So it's going to be up to law enforcement to ensure that the black market is not provided the opportunity to jump in on this, and that the proper commercially produced product is utilized, and that'll lie on law enforcement. So just going to speak very, very quickly on distribution. This is a provincial responsibility that's been downloaded as the government has determined from a federal perspective. The decision on distribution is going down to the provinces, and how the provinces decide on how they're going to do it will vary from province to province. As you can see, Vancouver, if you go down, you see dispensaries everywhere. That may be the way that you see BC go. It may not necessarily be the way Ontario goes, Quebec goes, or if you go far east, it may not be the system that goes in place there. So this is a photo I took in Colorado, and this is one of the higher end distribution systems in place. So you walk in, you take your ID, you have to prove your age, you're over 21, and they actually give you a device to scan the iPad, and they have the product right beside, and you go to the cash, and it's only cash in the States because the federal regulations do not accept that, and you purchase your product. So you can see how sophisticated a system can be. If you go in Ottawa here, or you go in any other places, you're going to see possibly a chalkboard and a defined, say what it is, Purple Kush or whatever, and give you the price. You don't know what you're getting. In Colorado, they set up a system from seed to sale, and they manage the product from the moment it starts growing to the moment it's sold. So this is a system that works in Colorado, but there's also faults in their system as well. And again, they have who regulates and who covers that. So that's one extreme of how well that could be run, and how clean and how professional it could be set up. But there needs to be a system to reduce the black market. So how do we reduce the black market? It's about supply and demand. So if when the government decides whatever product and how they're going to distribute it, they have to make sure that it's accessible to the consumer. If it's not accessible to the consumer, the black market will provide that accessibility. Price point. If the government chooses to price the cost of cannabis at a very high rate, we saw that with tobacco. You're going to see people going to contraband cigarettes, as they saw with tobacco, and you're going to see the black market we're going to be giving an opportunity for the black market to thrive. But just remember that it's about quality. So the key to, as well as understanding, and again, we're talking about education. So government-run, approved distribution system will probably provide a much better product. You're not going to see pesticides, you're not going to be consuming mold, you're not going to be consuming insects, and you know what you're going to be buying. So if you walk down to the beer store, you want to get a Brador, you know exactly how much that Brador costs and how much alcohol content is in it. It's written right on it. You go into the black market, they're going to tell you whatever. They're going to tell you what you need to know, and they're going to sell you the product based on what you want. So if you want to eliminate the black market, you need to prepare and provide a product that will be approved and accepted. So education and quality is going to be the key. So if you're going to the black market, are you going to be satisfied with consuming pesticides, mold, and possibly insects?
False.
Pardon me?
False. You painted a bleak picture here. LPs have had recalls because of banned pesticides.
Okay. Let me finish. But the black market does provide that. But if you're going into a government and a commercial product, that should be regulated and that should be guaranteed. So these are some of the things that need to be addressed to ensure that this product is eliminating the black market. The unlicensed market will provide opportunities, and the government needs to find that system that will work and appropriate in the right system. Access, cost, and quality is going to decide whether the black market will thrive or not. Talk to you a little bit about edibles. I know edibles is not part of the legislation at this point, but we may see that. And I talked about restricting early and then loosening things as we go along, but I do imagine that we are going to see edibles down the road. So that comes with a few concerns. Most of the population doesn't understand edibles. It's not a system that is well known, and it's not a system that's understood. So these are two photos of products that were available in Colorado. The one on the far right at the top is gummy bears, and the one on the left is sugar cubes. So what is the purpose of that, and what is the reasoning? So easily these products can be misconstrued. You put them down and the youth could grab them, or it could be misused. So the dosage could be, for one gummy bear, could be the appropriate amount, and someone may not know that and overconsume. So it's going to be a big issue. Potency varies. It's going to be a big issue. The onset is not like consuming and smoking. It could take 20 minutes, it could take 2 hours. And an inexperienced user could over-consume very easily. So the word is in Colorado, go low, go slow. So they actually tell you right off the bat the dangers behind it. Hospitals have seen an increase, and it's based on edibles. And from a tourism perspective, in Colorado and several other states, you can't consume publicly. You can't consume smoke in your hotel room, so they choose edibles, and they see problems with that down the road. So this is some of the issues that we see, and then access to youth in the schools is become an issue, and again, advertising. And you're seeing advertising in the bill that it's about making sure that the advertising is appropriate and targets the appropriate audience. Just going to speak quickly about vaping. The City of Ottawa right now does not permit vaping, and I don't anticipate that some of the other jurisdictions will allow it either. It is prone to misuse. Vaporizers can be used and manipulated to smoke marijuana, and it's very difficult to detect. In Ottawa, you can't use vaping anywhere. Parks, you can't use it on the buses, so it's a problem. So you're going to see, I think, from a responsibility perspective, you're going to see vaping probably not go the way of permitting public consumption. Unintended consequences, you're going to see lots of youth, again, using that opportunity for vaping and consuming in an open forum, and is not recommended from our perspective. In Colorado and other states, they saw a huge increase in the purchases of vaping and the use of vaping in and around in public areas. Reason to regulate, intentions on consuming, again, it's about transferring the use for cannabis. It can also be used for other uses, and some poorly made vaporizers can cause some damage. You've seen some explode. So from our perspective, CACP perspective, the vaping is not recommended, and you're already seeing some of the municipalities follow that lead, and that's been in place for quite some time. So quickly, just to finish up, black market versus commercial. This is a poorly run grow up, and you can see the hydro and the dangers regarding that on the right. That's the actual wiring for it. And the bottom, I've taken that from some of the commercial products and how professional they do it. How the black market operates is not going to be as clean in a product, but commercial is going to be the way to go. And from a law enforcement perspective, it's being regulated. You're going to know what you're going to get, and you're going to understand what you're going to get. And when you deal with the black market, there's some very, very sophisticated black market grow-ops, and there's some very poor ones as well. Well, I don't imagine there's been any questions, but just in case, I'll stick around for a bit.